Good morning, everyone, and welcome to the Field's COVID-19 seminar. I'm going to hand you over to Jan Hong, who will introduce our speaker today.
All right, thank you. Good morning. I'm Jian Hong Wu, and on behalf of the Fields Institute, would like to welcome you to this special seminar. Today's speaker is Kumar, Dr. Murty, the director of Fields Institute. So I assume you all know the reputation of the director and the Fields Institute being a director, the point is the director of one of the best research institute in mathematical sciences is a recognition of both the scientific achievement and the scientific leadership of Kumar. I just want to introduce a little bit about a very short history of how Kumar became a leading scientist, coordinate the interface between mathematics and public health during this COVID-19 pandemic. So it's in February that Kumar, on behalf of the Fields Institute, commissioned the National Task Force of Mathematical Modeling Rapid Response, and shortly after Kumar led the national team and successfully secured funding support from CHR for the COVID-19 research. And then Kumar became the co-chair of the Ontario COVID-19 modeling consensus table. And that capacity, Kumar has been a major figure in Ontario to ensure the science is the basis for public health decision making. So today, Kumar is talking about his own research, integrating the health and economic parameters to inform the mitigation strategy of COVID-19. So Kumar, please.
Thank you, John Hong, for your kind words and introduction. So as you know, we've in this seminar, we've been talking a lot about the mathematics of COVID-19. We've heard many talks about the epidemiological aspects. And as we're feeling to some extent, we're getting a grip on how to model those things. It's not by any means the end of the story on that. There are still new questions that keep being raised, some of them coming from the government. Leading to new kinds of problems, new kinds of modeling challenges. So there's a lot of work to be done there. But beyond that, what we're understanding is that, look, the pandemic is affecting all of society. It's not just about public health. There are many other aspects of society that are being impacted. And going forward for this pandemic, and also in terms of planning for future pandemics, we really need to understand the whole picture. We need to have a holistic approach to the way we're thinking about the pandemic. So we have started as a first step in this. We've started to try to stitch together, I like to say, the health and the economic models, and it's just a first step. As you can see, there's more work to be done. Also, I want to take a step back, and when John Hong was introducing me, you know, I suppose many of you know that my field is not epidemiology or economics or modeling. I'm a number theorist and algebraic geometer, and most of my work has been in that area. But it's interesting how, because of the pandemic, many of us are coming together with whatever knowledge or experience or expertise we have to try to bring it to bear on the current situation. So far, I've not found an application of number theory in this area, but who knows, maybe it will come in the future. So anyway, today then I want to talk about some work we're doing about taking a first step towards trying to stitch together the health and economic parameters when we try to model the impact of COVID-19. Okay, so let's see if this works. Yeah. So when we talk about mitigation strategies, let's see if mitigation strategies. There are a bunch of tools that now we are using, and that sort of become well understood. People around the world, governments around the world are using these tools, such as physical distancing, hand hygiene, masking, that is the use of some sort of face covering, school closures of schools, closures of offices, also closures of other retail or recreational facilities, restrictions on the sizes of public gatherings. So these are the tools that policymakers are using to try to mitigate the transmission of the virus. Interestingly, when we study these, most of our effort has been to see the impact of one of these at a time. But of course, there is some work where you apply several of these at a time. But the bigger challenge, even in the epidemiological side, is to have some sort of unified picture of what happens when I do all of these. What's the combined effect, even on public health? But as I said, the pandemic is having an effect on more than public health issues. And right now, Ontario is in a relatively good state, and I say that with caution because things change day by day. But we are in stage 3, and I haven't checked the latest numbers, but unlike other jurisdictions, there doesn't seem to have been an increase in cases in Ontario. I hope somebody will tell me that. Maybe somebody will correct me and say that the latest figures show otherwise, but so far I've not heard of an increase in cases. Now, as of today or tomorrow, today I guess, schools might open or is partially open, and we'll see what impact that has. But in any case, right now we are in a good point where things are not as bad as they were in April or May. On the other hand, it's naive to expect that there won't be a second wave, maybe multiple waves. So now is the time to really reflect on this, and we say it's not just a public health emergency, but it's a social emergency, and we need to think about all the different ways in which this is going on and what we might do about that impact. If not controlling it, at least understanding it. So the other areas, and there are more than these, I'm thinking about are education, social services, and of course the economic impact. So let's talk about education. 1.4 billion students around the world are affected by school closures, and just in Canada about 25 million. So that's a huge number, and these are young people. So it's a very important part of our population, of global population. There is, besides the loss of classes or not having classes, there is secondary effects of people whose academic career, as it were, is disrupted. For example, competitive exams, qualifying exams like the SAT have been canceled in some places. On the other hand, we may say, well, let's shift from in-person instruction to online instruction. Well, here's the interesting thing, that even in places where we wouldn't think it to be a problem, we are seeing the effect of unequal access to technology. I'm seeing this now already in working with various people, that we're talking on the one hand about introducing 5G, but there is, on the other hand, even regular access to a reasonable amount of bandwidth to be able to take instruction online is not necessarily a given. Some of you may know that this past spring rather, the Faculty of Arts and Science at University of Toronto canceled the final exams because they weren't sure that students would have equal access to be able to take the exam online. So online instruction is possible, but we don't yet have equal access to technology. And then the whole issue is, what is the actual learning outcomes that students are experiencing? These preliminary studies suggest that there is a certain stunting or an abbreviation of student learning outcomes. Then there is the whole issue of what you learn outside of classrooms, so social interaction. All of that is missing. Then there is who takes care of the children if they're not at school. So there's a demand on child care at home. And here's an interesting extreme statistic. It has an indirect impact on the quality of health care available to the public at large. Why? Because 70% of the healthcare workforce is female. And so on the whole, they're at home taking care of their kids. And so this has both direct and indirect impacts, and that has to be also understood in our models when we suggest a certain intervention, especially if it's going to carry on for more than a week or two. What is the impact of this? Then there are social services. The United Nations has extensive reports about this, and we all know this. We've heard this also in local reporting, that although as is often said, we're all in this together, it's not the case that all segments of the population are affected equally. Certain segments are more vulnerable. You're homeless people or refugees or migrants. You're told to shelter safely at home, but you don't have a home, so that's a problem. Then there are people with chronic health conditions, especially the elderly with reduced mobility. How will they stay in isolation? How will they take care of themselves? How will they address the need for additional hygiene that this current pandemic is demanding? Then there's always the issue with people who have mobility restrictions, limitations. They'll have difficulty in isolation even for performing daily tasks. And then Canada has a significant indigenous population. They may have lack of access to adequate infrastructure and medical facilities, public health facilities. So it's clear that there is a certain large segment of the global population that is more vulnerable to these impacts. And then all of us as a whole are missing certain social activities such as sports and entertainment. You may think that in juxtaposed with the homeless and the elderly, this is not that important, but in a sense you're right. But on the other hand, in long term, it does have an effect. And so the canceling of major sports events and entertainment events does have an impact on all of us. Then, of course, there's the economic impact, which is what I really want to talk about today. Just in Canada, unemployment is still at more than 10%. Consumer confidence is low. That means our willingness to spend money is low. Apparently, it's lower than during the 2008 crisis. The border with the United States is closed. That means that daily traffic to Ontario, which used to be at 250,000 a day, is now under 2,000. You may say, when the border is closed, why is there any traffic? Because there is some emergency traffic is allowed. That comes to about 2,000 a day, 2,000 people a day. So that certainly has economic impact, because those people come here for a short time and go back. But while they're here, they spend money here. And there are projections of the GDP. It's expected to drop globally, and more so in different jurisdictions than others. But everywhere, we're not seeing any place that's saying our GDP is growing. Okay. So in the light of that, what we really want is, what I'm asking is a kind of a program. What we need is an analysis that combines all of these, all of the possible strategies that are at our disposal, the ones that I listed at the beginning, like closing offices or requiring masking or limiting the size of public gatherings. And then to understand their joint impact on society, not only on public health, but also on the economic aspects, the social services, the education, and perhaps the other aspects as well. So our goal is to develop an integrative model. And the first reaction, by the way, when I said that this is what we need from modelers, is that it's impossible, because all the assumptions, even in epidemiological models, the assumptions from one model to another are different. And how are you ever going to reconcile them? And how are you going to bring them under one united form? Well, yes, it is difficult, but you can already see how important it is. And so I think that is the way forward. We need to find a way, some common framework in which we can see all of these playing. And then when policymakers have to make a decision, they will understand that things are not working in isolation. If you pull one lever, many other things are going to change as well. And so it's good to at least be aware of how they change, so that you make an informed decision. Okay, so I'm not working on this alone. I'm working with a bunch of people. In fact, I consider myself the junior person in this team, because I'm learning. So there are 3 PhD students: Alik Sokolov, Jonathan Mostovoy, Yichao Chen, and 1 undergraduate, Andrew Roberts. Andrew is at Queens, and the first 3 are at U of T, together with my colleague, Luis Seco, who's supervising 3 PhD students, and myself. So we started asking these questions a month or 2 ago, and what we're showing you is our preliminary results on this, which are already, look to me anyway, very interesting. Also understanding that it's still, it's interesting, but it's still, I consider it preliminary, and there's still a lot of work to be done. Okay, so what we have is, what we're trying to do is we're trying to stitch the models together. So we have a bunch of levers, such as physical distancing, masking, testing, contact tracing, and so on, or closing facilities, schools, offices, limiting size of public gatherings. And all of these have certain impacts: the prevalence of the virus, economic activity, unemployment, mental health, etc. And so the picture is sort of to be illustrative of, you've got this multidimensional function, some kind of utility function that you have yet to define, that converts the levers, the settings, the parameters that you have under your control, and translates them into a number, which gives the social impact, taking somehow all of these into account: prevalence, economic activity, unemployment, mental health, and so on. And then you're looking for extreme values of that function, either to maximize or to minimize. That's really the problem. And I will tell you that so far, what I've seen people do when they're confronted with this multidimensional extreme value problem is to sort of take a guess that, this parameter can be in this range, this parameter can be in that range. And fortunately, the people who do this, their intuition seems to be amazing. So we're not in any disaster area yet. But from a mathematician's point of view, we want to have some sort of quantified way of identifying extreme points, extreme values. Okay, so that's the goal. Okay, we're looking for some sort of optimal assortment of interventions with respect to the various outcomes, such as public health, economic, academic, and social. It's a understatement to say the field is of great practical importance, but here's the interesting thing. You go and look in the literature, there's very little of this in the literature, very little the documented work which tries to bring together the different features together into one model. So while it's of great practical importance, and there's an urgency for all of us who are interested in this to contribute to it, but it's also of great scientific interest because it's a open field. Very little work has been done. So anything that we are able to contribute to this field will be a very important step forward. So it's almost like it's very clear that independent of what's going on elsewhere, this is a good focus for a scientific program. And it will involve many people. I mean, not just the mathematicians, but it will involve those people in economics and sociology and in education and in public health to collaborate with us. So it's a really interesting and large and important interdisciplinary activity that we need to undertake. So here, what we're going to try and do is we're going to try and stitch 2 parameters together, 1 health parameter and 1 economic parameter. The health parameter is the caseload, the number of cases of the virus, and the economic, the epidemiological parameter, the health parameter is that, and the economic parameter is unemployment. And we're trying to illustrate how you can model both of these together. Okay, so to start with, our starting point when we started first thinking about this was a paper, a Stanford paper by authors Hall, Jones, and Klenow. And in that paper, what they were trying to do was study the relationship between consumption and mortality. So consumption is the act of individuals to buy things, goods and services for their own utility. In other words, it's different from spending money to invest in something. It's something I buy to use. So they wanted to study the relationship between consumption and mortality in the pandemic. So, public health restrictions have resulted in a decrease in consumption. In fact, they have. And so the question they wanted to answer is, what reduction in consumption is society willing to accept to keep COVID mortality below a certain threshold? So if we all move about freely doing our thing, going to stores or interacting with people, then that's going to raise mortality. And so to avoid that, I've imposed certain restrictions whereby my movement is restricted, and as a result of which my consumption is down. And now the question is, what reduction in consumption are we willing to accept willingly because we want to keep the mortality below a certain threshold? Consumption is a really large component of something called the gross domestic product, GDP. In fact, maybe as high as 60%. The GDP is actually made up out of a number of factors, which my colleagues in the research group have taught me. But consumption is a major part. And ultimately, where we will take this study as we understand it more is we will actually give, try to stitch GDP together with health parameters. And as you'll see, the paper, in the Stanford paper, they make a lot of simplifying assumptions. That's okay. I think my main point is because we're at the beginning of a subject, it's okay to make simplifying assumptions to get us started and to understand and see at least what's possible. Okay, so let me see why this one. Yes. Yes. Okay. So the way these things work is you define a utility function, giving the economic value of consumption at a time t. Okay, C sub t is consumption at time t. So let's denote by S sub a plus 1 the probability that a person of age a will survive to age a plus 1. Okay, so strictly speaking, it's a function of both a and a plus 1. And SA sub t, a comma t, is the probability that they survive to age a plus t. So assuming independence in time, SA comma t is the product of these probabilities, SA plus 1 to SA plus t. Now, let's say the lifetime utility of a person of age a in terms of consumption is, so you look at time t, you look at the utility afforded by their consumption at time t, and then the probability that they're going to survive for the next t years. And that is considered the lifetime utility of a person of age a. So that's their expression. And if you take the t equals 0 term, SAA of course is 1, so you get U of C 0, plus then from t equals 1, you can factor out an SA plus 1, and you get this formula. Okay. Now, you may want to refine this a little bit by discounting the future value to current economic terms. So you can introduce a certain discounting factor of beta. We'll ignore that. Yes, okay. So suppose that then as a result of the pandemic for 1 year, the probability as a plus 1 of surviving from age a to a plus 1 has decreased by a certain amount, delta a plus 1. This is the mortality impact of the pandemic. And let's say that consumption decreases by some fraction alpha. Okay, so now, and let's set lambda to be 1 minus alpha. So now we consider a modified lifetime utility function, VA lambda delta, like this. What is VA lambda delta? It's the lifetime utility of a person of age A whose consumption is reduced by a factor of lambda in the current year, and whose survival rate for the next year decreases by delta A plus 1. And then consumption and survival both reset after that year. In other words, my survival rate for the next year has gone down, and to sort of deal with that, I've also reduced my consumption by lambda. Okay, so then if you do those parameters, then what happens? What I had on the previous page, this V sub A equals this one, becomes replaced by this formula. Okay, so that the initial time consumption is down by a factor of, is been replaced by lambda c, and then the next stage, the survival probability to the next year has been decreased, but then after that it gets reset, so it goes back to 1, 0. Okay. So now you take that, that's for an individual, and then of age A, and you average it over the population, and you get some sort of population-wide utility function. So now delta by delta is a vector that's specified for each age A. N sub A is the population of age A, the number of people in the population of age A. So you get some function W lambda of delta. Now, I told you this is like really a toy model in the sense that you make assumptions to simplify. So here's an assumption that consumption is equal across all ages. Obviously it isn't, but let's say it is. Then what happens is you can rearrange this. You can take out the, remember in V A lambda delta, there was this part U lambda C0. So you can bring that out, that's independent of age. So you get N, which is the total population, times U lambda C plus this sum. Okay. Now the question then, to phrase the question, what decrease in consumption are we willing to accept to reduce mortality by delta, is then this equation. In other words, if here, did I go back or forward? Yeah. So if I really want W lambda 0, in other words, I want to decrease my consumption by lambda so that there is no increase in mortality. So I want W lambda 0 to be W1 delta. So 1 delta is if I don't decrease my consumption and there is a mortality rate of delta, this is what happens. And I'm saying I want to shift this delta somehow into the lambda. Okay, that's the equation I want to solve. So if you look at the previous thing, I have this, and I want this to be equal to W lambda 0 to be equal to W1 delta. Okay, so you simplify that and you get this. So far, notice I've not specified the utility function. So you get something like this. U of C minus U lambda C is this. And again, you make an assumption that this consumption is same across all age levels. What is this term here, VA plus 1, 1, 0? Well, it's simply the utility function at consumption level C times life expectancy at age A. This is this quantity here is simply expectation of life, the length of life, right? Because these are all probabilities that the person survives to T. So this whole thing is just the expectation, life expectancy at age A. So this quantity here can be written as the utility function evaluated at the current consumption times life expectancy at age A. Okay. So then as a first order approximation, you say, well, I haven't specified a utility function. And by the way, in practice, people choose a utility function. And even in their paper, they take various functions. But at this stage, if you want to just make a first order approximation, you think of this as a function of lambda now, and just take the first order approximation. So you replace it by U prime C times 1 minus lambda, the first term in the Taylor expansion, and you get an expression for 1 minus lambda that looks like this. And so what you have is that this is the decrease in consumption is evaluated in terms of weighted numbers of population distributed according to age. There is some weightage here given by mortality rate. There's a life expectancy here. And then there's this weird thing, U of C over U prime C over C. And it turns out this can be interpreted as if you can say it this way, the value of a year of life in terms of consumption. So this is something economists seem to be comfortable talking about. How much is a year of life worth? Yeah. And moreover, not only that they ask that question, but they also want to translate that into consumption. And they estimate this number numerically by associating a number to the value of remaining life and dividing that by the average life expectancy. So they hear estimates from the United States that for a person of age 40, the value of a year of remaining life in the US is 185,000. So in the US, I guess everything can be given a dollar figure. So age 40, the value of year of remaining life is $185,000. annual consumption per person is average $31,000. So that means the value of a year of life is worth 6 times annual consumption. Okay, it's remarkable that they're able to say it this way. But anyway, the value of a year of life is worth 6 years of 6 times annual consumption. So you use that in the calculation. We will use this number as well. Okay, so therefore, putting all this together, what do you have? Delta is the increased mortality rate because of the virus. Lambda is the average remaining life expectancy. That means a person who dies from the virus would, under normal circumstances, have expected to live lambda more years. There's a typo here. This is lambda. Nu is the value of a year of life measured in terms of annual consumption. And then the reduction in consumption at the current rate of mortality is given by this, delta nu lambda. So you can pull out some figures here. If this lambda, the average remaining life expectancy, that is how many years a person who dies from the virus would under normal circumstances have expected to live. Apparently in some, it's a US study, it's 14.5. Nu, we've already said, is 6. And this mortality rate is, at that time, was estimated 0.0044. So 0.44%, I think it's actually higher now. So this means that this translates into a 38% reduction in consumption. Okay, so now economists have a number. Equivalently, suppose I turn this number around and say, it's not how much I want to reduce consumption, but how much do I need to reduce mortality to be able to bring consumption up? So if I want to bring consumption back to 90% of what it was pre-pandemic, mortality has to decrease to less than 0.18%. Okay. So now let's, with that in hand, let's have a look at so this was all about consumption and mortality. And now we want to look at transmission and unemployment. So again, remind you, the mitigation strategies we have are that we can close office buildings, we can limit mass gatherings, we can implement mask mandates, we can close schools and research institutions, universities, we can close retail stores and restaurants. So this gives us 5 possible policies. Of course, you can increase this list. By the way, everything in our model is dynamic. That means you can easily increase parameters and the model will accept it. So here we create a 5-dimensional binary policy vector to indicate whether the corresponding policy is on or off. So for example, if you look at the policy vector 00011, that means that schools and research institutions are open, rather schools and research institutions are closed, retail stores and restaurants are closed, but the first 3, that is offices, mass gatherings, and masking are not implemented. That's all that means. Okay, so I just have it as on or off. So that's obviously, again, a simplifying assumption. So each of these policies, these strategies, is either on or off. Okay. Then these settings are translated into numerical values for the average number of contacts per day, the quarantine fraction, and transmission probability. In other words, if I implement each of these or don't implement these strategies, then what does that tell me to do? What does that tell me about the average number of contacts per day? What does that tell me about the quarantine fraction and the transmission probability? So here we rely heavily on John Hong's work. A couple of their papers have been extremely useful. And we start with an initial condition that gives an R effective of 0.7. Every 14 days in the scenarios that we look at, a policy change is made. In other words, this policy vector is changed. And for the simulation, it's random change, is stochastic in a certain way. And so that at any time t, you get a policy vector p sub t. Okay. And John Hong's model is quite delicate and quite extensive. So he's divided up the population into susceptible, exposed, asymptomatic infectious, symptomatic infectious, recovered. And there's a quarantine fraction, that is the proportion of individuals who are exposed to the virus who are traced and isolated. You've got also there's a certain transmission probability beta, and all of these are connected with a long list of first-order differential equations. And numerically, we use from John Hong's paper the quarantine fraction, that is the proportion of individuals who are exposed, who are able to be traced and isolated, we used it as 0.3721. Okay, and we need a numerical value for beta, that is the transmission probability, and for the average number of contacts that result from various policy interventions. So we assume that of the 5 policy interventions we're looking at, beta is only affected by masking and not by the other interventions. Beta is the transmission probability. On the other hand, the contact number is assumed to be affected by all of the other 4 interventions: school closures, restaurant, retail closures, office closures, and limitations on the size of public gatherings. And so maybe from John Hong's paper, we got the effective reduction in transmission rate by masking is 79%, and we assume 50% compliance, although in Canada it's probably higher than that, so that we get a beta of 0.395. We also assume baseline number of contacts without policy intervention is 15, and then estimated that because of each intervention, contacts are reduced in the following way. I think this is maybe already in John Hong's paper. So school closures reduce contacts by 3.5, restaurant retail closures by 3, office closures by 2.5, limitations on size of public gatherings by 3. And John Hong also gives us an explicit formula for R effective as a function of a bunch of parameters. I was going to say it's too complicated a formula to write down, but then I felt funny for a mathematician to say a formula is too complicated. There's a formula. His group has come up with a really nice formula, which is really useful. And most importantly is the connection to the way that C and beta figure in that formula. Now the question is, what is the effect of each intervention on unemployment? So firstly, to estimate overall impact of a strict lockdown, we looked at aggregate unemployment numbers. Statistics Canada gave us unemployment numbers between March and June. So that delta is what we said is the overall impact of the strict lockdown. And then you've got to look more closely at the different industry sectors, and StatsCan gives a long list of such sectors, agriculture, forestry, etc. And then you have to estimate the relative impact of each of these actions on that sector. That part actually was a kind of mystery to me, but the students in our group seem to know how to do that. And then finally, you get across each sector, you get horizontally the impact, the unemployment impact of each intervention, and then you total vertically. So across all sectors, what is the unemployment impact of each intervention? So here is the numbers that they came up with. For school closures, it's 1.93%. Restaurant and retail closing is 1.54%. Office closures, these are the numbers. So you get a certain vector of impact on unemployment of the various interventions. P sub T is your policy vector. You know, something is on or off, so you take the dot product, and that gives you the change, the resulting unemployment as a result of this policy choice, policy vector. The utility function that we're going to try to find an extreme value of will be a sum of 2 functions, one for the caseload and one for unemployment, UC and UE. And maybe there's a better way to put them together, but in the end, we just added the 2 together. You see, U of T is UC plus UE. So the caseload impact on utility is the average life expectancy lost due to COVID. As we told you above that we were using 6 years of consumption is the price people will give up for a year of life expectancy. So the utility function in terms of consumption is that nu times the number of cases at time t times the lambda, the quantity lambda, that is the number of years people would have survived if the pandemic weren't there. And there is a R, which is the mortality rate. And we've added in a 1 so to take care of also morbidity. So this idea is to try to encompass both mortality and morbidity. Okay. And then assuming each job that's lost comes to 1 year of lost consumption, which is probably also not completely right, but anyway, that's the assumption. Then the unemployment contribution to a utility function is this, U sub E, which is nu times U sub T. And then the two utility sub-functions are combined in this simple way. We just added the two and then averaged it over, took the sum over time. Okay. So then we did 10,000, maybe more than that actually, simulations over randomly generated policy vectors. And the policy was changed every 14 days. So we're doing modeling over 1 year, 365 days. So every 14 days, the policy vector gets changed. And it's by a simple rule with probability 0.15, a particular policy is or is unchanged. Okay, so you generate a large number of policy things to do every 14 days, and then you run 10,000 of those kind of simulations. And in doing that, then during the simulation, then you compute the R effective, and you see it has a nice distribution. So this was just a check to make sure that we had not chosen simulations that were skewing R effective in a certain way. So it's for the bulk of the for the simulations, we are roughly around between 1 and 1.2. And similarly for unemployment, for the bulk of the simulations, we're at about 8% unemployment. The horizontal axis is percentage of unemployment. Okay, so we have a bunch of scenarios that look okay, and then we find that for unemployment and R effective, there is a particular sequence, optimal sequence of policy interventions. There's opening and closing of those five policy interventions that results in this kind of figure of the unemployment rate. That is, it goes up and down, but and then similarly the R effective also goes up and down. Notice at some point it goes up to something like 2.6, which is probably too high for a short period of time, and then comes back down. So most importantly, now we can say here, I'll say more comments about these scenarios later on, but most importantly, when you plot, use these scenarios to plot not the utility function, but the cumulative caseload on the horizontal axis and the average unemployment on the vertical axis, you discover, and I was quite charmed to see this, that there's something called an efficient frontier. So, people who work in portfolio theory do this when they're trying to measure the risk and reward of various kind of portfolio investments, portfolio decisions. And then you hit across a sort of frontier that is a sort of boundary to this whole domain, which means that you can't do better than that. Of course, I'm assuming all the assumptions we made, taking into account all the assumptions we made. You can't do better than that. In other words, that if you want to keep the cumulative caseload below a certain thing, you got to accept unemployment at a certain rate. So if you want to keep the caseload low, there's a point you won't do better than a certain point in terms of average unemployment. This doesn't tell policymakers that you should choose this or that, but it just tells them that there is a boundary. So then you have to choose somewhere along this boundary. Where is your comfort zone? If you want to allow, okay, if you think no, at all costs we've got to bring the unemployment down, then it's just a fact. The caseload is going to go up, and then the question is, does it go up to a manageable level or not? Okay, so this is, as I said, really preliminary work or first attempt to do this. As I told you at the beginning, the literature is very sparse. People haven't tried to do this, and we have yet to take. We just took one health parameter, one economic parameter to illustrate, but clearly you need to take all the parameters at once. So there's a lot of work more to be done. Let me just say a few things that are to be done. Firstly, we just took 5 policies, but you can in fact take more policies to account for more complete range of policy choices and their granular impacts. Also, we took each policy to be on or off. You open schools or you close schools. But in fact, you may want to do something more nuanced, a partial opening of a school or an office. So we need to have non-binary policy vectors. There's no good reason why we didn't do that. We can do that. It's not much more complicated. But of course, if you look at running a lot of scenarios for the optimization, you need to discretize that in some way. But that can be done. Then there's the whole issue of policy adherence. You may mandate a certain policy, but will people follow it? Now, you notice that in John Hong's model, there was this whole issue of when you say quarantine fraction, the idea is that you're not even able to catch more than a certain percentage of people to impose quarantine. But in course of time, even if you did impose quarantine, will it actually hold? So people may get a certain fatigue in adhering to certain restrictions, a kind of false sense of comfort that, look, everything seems to be okay, nothing's happening, I can take my mask off. So there's this whole issue of how you include that kind of thing, diminishing returns in policy adherence as time progresses. And then we haven't included other sources of uncertainty, such as a random or unexpected outbreak in a community or in the population as a whole. We haven't looked at that, and that can be included. When we talked about these optimal strategies of when you get optimal unemployment and are effective, that comes from a sequence of openings and closings. And the problem is for a math problem, of course, it's just a 1 or 0, you turn it on or off. But in practice, all of that has cost. So every time you open something and close something, there's a cost. So the cost of opening and closing facilities to schools and offices hasn't been taken into account, and maybe we need input from from finance, Ministry of Finance, to give us some idea of what those costs are. We haven't done any kind of stratification or segmentation of society. Age is certainly a stratification that has to be taken into account, and I think John Hong is the person who can help us understand that. But there are also other social drivers that have to be taken into account in stratification, long-term care facilities, and other heterogeneous aspects of society that we've already seen playing an important part in the way modeling has to be done. Then there are interventions which may take place when R effective crosses a certain threshold. So, for example, here you see at some point R effective is shooting up to 2.6. And presumably nobody will allow that. In fact, there'll be alarm bells already here, even though it is for a short period. So what does that mean? That is, in what intervention will take place at that point, and what impact will that have on the calculation? And then our utility function is still pretty naive. I think we have to think about more refined utility functions, and also we need to make sure that we're not choosing inadvertently a utility function that's producing the kind of output that we're looking for. Mm-hmm. As I said, I really was happy to see the efficient frontier, but I want to make sure that's not an artifact of our choice of function. And then there are more economic parameters. I already told you that, for example, we are working now on modeling the GDP, which is a combination of, I think, 6 or 7 different factors, of which consumption is one, unemployment is another. It seems that we do have roughly the groundwork done for that, and so we will be in the near future trying to model impact on the GDP. And of course, that's of great interest not only for the Ontario government, for other governments as well. And there may be other parameters from other areas of impact. The one I was discussing at the beginning of the talk, from education and mental health and social services, all of those things. So ideally, we want to have some monster model that does take all of this into account. But we need to go step by step to build it, and it's a very, very interdisciplinary approach. So we need help and expertise from all quarters to do this. Okay, that's I think all I wanted to say.
Thank you, Kumar. So we are open for questions, and for those of you who want to ask questions, you can raise your hand, and we'll unmute you, or you can send a chat that we'll unmute you. I do have a question first of all, Kumar. Thank you very much for a very nice presentation. So the choice of utility function is the Stanford group is doing. So it's putting much less weight towards the senior, I guess. So because the life expectancy is going to get significantly shorter and shorter towards late. So that might be a sensitive issue. So the mortality is more on the seniors, and you count them much less. So
absolutely. So therefore, you need, even in their model, we need a more age stratified model. They make some comments about that, but they don't really work one out. So I think there's some scope for some work there.
Second is common. It's really it's very nice that you're able to calculate the impact on each economic sectors from all this change of the contact in different age groups. That's a very nice contribution.
That's the students.
yeah, of course. So is all this posted online now? Or?
It might be. It will be. If it's not, it will be very soon. The preprint is available, and also the code is available. So if anybody wants to run the simulation themselves, they can do that.
Yes, because anyway, you give presentations. It's a videotape, so it could be what is accessible to everybody. So it's better to post the print so we can refer to.
And as I said, look, we are inviting collaboration. This is a big project. It's a really big project. I think very soon any one of us will feel out of our depth in terms of having to deal with these parameters, understanding these parameters. So it's an invitation really for people to start thinking about this.
Now, another question, because Kumar, you are sitting on multiple hats, and this might be one of the places you can use one of your hat. So since it's going to involve so many different fields, where the modeling framework is going to put everything together. So would it be fields institute be interested in organizing kind of thematic project among different, so putting things together, but in different weeks you have more focus, so you can bring stakeholders together and do some of the more in-depth exchange.
Yeah, no, that's a really good suggestion. We've already thought about that, and we've sort of written it into the coming year's activities.
Right.
We do want a thematic program of that kind, exactly that kind, quite interactive. And I repeat what I said at the beginning. This is, of course, of great practical importance right now, but it's of great scientific importance too, because the field is wide open. No, you go and look in the literature, and it's very sparse. So now is the time to sort of we're creating a new field, really, as it were. This kind of modeling doesn't exist yet. So certainly fields would want to host that kind of activity. So stay tuned. We will be reaching out to you and others to help us organize that.
Great. So are there other questions and comments to Kumar? We have a couple of minutes.
Somebody's raising their hand here. I don't know your name, sorry. I don't see your name. John Hong?
I don't see anyone in my side. I'm very bad in.
So I think you can go ahead and speak. We don't know your name. We can see you, but we don't know your name.
Let me see.
We can't hear you. Are you unmuted?
Hello.
Yes, we can hear you now. Yes.
Oh, good. Yes.
Hello. Thank you for
Yes,
your
hello.
presentation. It's very interesting. I have just one question. Which parameter reduce the mortality rate in your utility function?
Which parameter? What?
Reduce the
Mortality?
mortality. Yeah.
So you're talking about the original Stanford thing, or what we did? We weren't looking so much at mortality. We were looking at unemployment on one side and the caseload, prevalence on the other side. But we went through, we used the Stanford thing to go through. You say unemployment means 1 year of unemployment is roughly 1 year loss of consumption. And then we use their thing to say that means mortality decreases by this much. Therefore, it means this much caseload. That's how we stitch those two together.
Okay, thank you. Thank you for it.
All right, so if I don't see any other questions, so I assume this is going to be again videotaped and the recorded will be available publicly. And again, thank you so much, Kumar, and I highly request that you really put in the printer so people can find a place to do it. Thank you very much.
Thank you. Thank you.
See you.
Bye.
Bye.